Hi everyone, my name is Maddie Nance. I'm a graduate nursing student at West Texas A&M University, and this semester I'm taking my fall practicum course, and I'm focusing on nursing education. So for my project, I am doing improved NICU staff education, specifically relating to better emergency response preparedness and trainings. So I've been working alongside my NICU nurse educator, where I currently work in the NICU and where I have worked for almost 3.5 years now at Covenant Children's Hospital in the NICU. So, for my learning objectives, my first objective is to analyze preventable healthcare errors by new graduate neonatal intensive care unit nurses and develop an educational approach that highlights patient safety and improved clinical judgment. And then my second personal learning objective is to develop an educational lesson specific to new graduate NICU nurses that addresses neonatal emergency response actions and skills to minimize or reduce healthcare errors. So, specifically for my project, I have been working alongside my nurse educator, like I mentioned before, to initiate mock code trainings and delivering education regarding unplanned extubations and how to react in this situation or scenario specifically. So, to start out on the mock code scenarios, we do like a typical shift handoff report to a group of nurses, and then the scenario begins, and we get to see how well the nurses respond to each scenario. Like the one that we're currently working on, like I have mentioned, is for unplanned extubations. And so really harping on our neonatal resuscitation program skills and making sure we have our emergency equipment ready and that nurses know how to respond. Aside from these clinical education trainings that I've been working on, I've also been working with my nurse educator with Clinical Academy is what we call it for our new graduate nurses, where they learn important skills such as NRP, which is our neonatal resuscitation program that we follow, along with other educational lessons about caring for NICU patients. So for my article this week for our discussion, I chose the article titled Using Simulation-Based Training to Improve Neonatal Resuscitation Clinical Competency, Confidence, and Comfort Level of NICU Caregivers. So, in summary, the article conducts a study with a 48-bed level 3 NICU, which is pretty similar to our unit. Our unit, however, is a level 4 NICU, and we hold up to about 45 patients. And in this study, they held mock code trainings, and these were implemented, and then a pre and post survey were used to evaluate the effectiveness of the training. So overall, the article highlights that 10% of newborns require resuscitation in the NICU or in the delivery room. The article goes on to mention the importance of regular mock code trainings as regular reminders of NRP training because these can reduce mortality rates and improve patient outcomes in the NICU. The article mentions some great points, such as that proficiency in emergency response training can fall as nurses are just not exposed to real life code situations. In the NICU, it is rare that we get to the point where we're fully coding a patient. Normally, our respiratory interventions beforehand prevent us from going all the way to chest compressions. However, being exposed to a potential real life situation like a mock code is good practice for nurses to have, especially for those like new graduate nurses who have not had this experience before. Again, the article mentions that allowing nurses to practice in a safe environment where NRP interventions can be addressed and questions can be answered is beneficial. Overall, the article found that improved confidence and comfort was improved with the mock code trainings. However, a significant difference in scores would probably show better if mock code trainings were regularly implemented and not just over a short period of time, like the 3 months in the article. So this shows that along with my project, I plan to implement regular emergency response trainings, and hopefully these can be something that our unit continues to do. And so, along with my clinical and didactic education, I hope that our staff, including our new graduate nurses, feel comfortable and confident in a potential code situation. Our unit is also currently highlighting the importance of preventing unplanned extubations and how to act in a scenario when this occurs. So I thought that it would be important to include this in our mock code scenarios. And I think so far it's been great seeing the staff ask questions and seeing where we can improve in the future for this to prevent this from happening again. I hope to also incorporate an unplanned extubation bundle, such as like a poster or a badge buddy, as a reminder for staff, along with the emergency mock code trainings. Overall, this is a little bit about my plan for my project this semester, and I thought that this article really highlighted the importance of mock code trainings, especially for specialized units such as the NICU. Thank you.